When I first got diagnosed, first thing I did was go to the MS Society.
It's different from any kind of help I could get anywhere else. And I don't know where else you can find that.
To me, the Society it's really tackling the problem of MS from many different levels and in many different ways and with many people involved. Our work is to try to help people learn strategies to manage those different symptoms.
The MS Navigator program is probably one of the strongest programs. Having an opportunity to partner side by side, someone who's going to own your issues with you and really help you from start to finish is a service that not a lot of other societies offer. It's a companion to walk the path.
The MS Navigator program is help from a place from people who just get us. I don't have to explain to that person at the end of the phone what it's like to live with MS. There is no judgment. The only thing he was concerned about was helping me move forward and helping me along a process. So I guess Navigator is a really good name for it because ultimately he helped me navigate a great big problem.
I see Dr. Kita twice a year. Having somebody that understands MS and knows what to do and what drugs are available and what symptoms you have and what you have to worry about, that's priceless. You need to have someone that's a specialist.
The MS Society has helped a lot. They ask all the questions that I may forget to ask or mention. They're like, what about this? I'm like, oh yeah, I forgot because I was going to ask that. They're like my backbone. They help me to remember and recall different things.
As bad as the disease is, it also brings out the best in people sometimes. They come much closer to us, and that's some of the best things about MS is it brings people together.
I have been leading groups for probably a total of about 20 years. When I meet people who have MS, I usually encourage them to get involved with the MS Society. I also encourage them to get with a group. And what I think has been life-changing for many people is the fact that now we have men's groups, we have women's groups, we have couples groups, we have young adult groups, we have newly diagnosed. Go try one. If it doesn't feel right to you, try another one.
Bueno, con el grupo de soporte me ha ayudado mucho porque conocí a otra gente que está pasando por lo mismo que estoy pasando yo acerca de la esclerosis múltiple.
The Society often offers a lot of their programs via telehealth, via webinars, through distance technologies that allow a lot of people to participate in things that they otherwise wouldn't be able to participate in.
Everyday Matters was a program that the Society put on, and it was great because I live in a fairly isolated suburb. I'm about 2-hour drive from Seattle. They did it over the phone, and I was so happy that I could access that. They had a number of strategies to help, improve your life, and that helped also with building, the strength to be able to use the poles.
We'll have patients who they've got some need. It might be some exercise equipment, it might be some mobility equipment, and the National MS Society has different resources that they can contact, other funding sources to help people in need.
By helping people learn strategies to manage their health and to live well, you can potentially change the course of their disease.
They just basically helped you to understand that life doesn't stop with MS.
I feel like the MS Society has my back. And that's a pretty cool thing.